Good afternoon, everyone. I'm Nirav Shah, the director of Maine's Center for Disease Control and Prevention. I'm delighted to be able to join you all this afternoon on a snowy Tuesday to provide everyone an update on where we stand with respect to COVID-19 for all across the state of Maine for today, February 2nd, 2021. I begin on a sad note. Maine CDC has recently received reports of an additional 23 individuals who have passed away with COVID-19. Now, I'd like to pause because this is a high number, certainly much higher than we've seen in recent weeks. Of these 23 individual deaths that we have received reports of, 21 of those 23 were reported because of the work that we do to comb through death records from time to time to ensure that we are accurately and completely capturing all of the information around COVID-19 deaths across the state of Maine. Again, 21 of the 23 deaths for which we are reporting today were generated as a result of that periodic review of death certificates across the state of Maine. For the 21 deaths identified from our vital records review process, the date of death ranges from December 21st, 2020 through January 26th, 2021. And indeed, of those 21 deaths, the vast majority, 19 of the 21, were individuals who died from January 13th onward. Just as a reminder, and we talked about this a few weeks ago, but in order to ensure that our understanding of all of the deaths in Maine is both full and accurate, Maine CDC epidemiologists from time to time go into our vital records database to look for individuals who may have passed away with COVID-19, but who didn't have a test result, but rather whose medical provider indicated on the death certificate that COVID-19 was a cause of death. This may, for example, have been an individual who was in hospice, who had signs and symptoms consistent with COVID-19 because maybe they were a close contact of somebody. But for various medical and compassionate reasons, the medical provider didn't feel that a test was something that needed to be done because all signs pointed to COVID-19 being the cause. That medical provider may have indicated as much on the death certificate. That's why we, again, from time to time, go through those certificates to make sure that we are capturing those. That gives us, again, a full and complete picture of the toll that COVID-19 is taking across Maine. The fact that these deaths were not reported to us at the time does not for a second diminish the impact that they have on the families, friends, and communities of those who lost their loved ones. Of the 23 deaths that we are discussing today, 4 of them were among individuals in Aroostook County, 4 were from Cumberland County, 2 from Kennebec County, 5 from Oxford County, 4 from Penobscot County, 1 from Somerset County, and 3 from York County. Of these 23 individuals, 2 of them were in their 50s, 2 were in their 60s, 8 were in their 70s, and 11 were in their 80s. 7 of them were women, and 16 were men. Their passings bring in Maine now the total number of deaths associated with COVID-19 to now 618 since we began our work on the pandemic about 1 year ago. We'd like to offer our deepest condolences to all of the friends, family members, and communities who have lost one of their loved ones to COVID-19 in the past year. Across the state right now, there are a total of 39,960 cases of COVID-19. Of those, 32,118 are confirmed cases, 7,842 are probable cases. Over the past year, since we've logged our first case, 1,403 people cumulatively have been hospitalized, and just in the past 30 days alone, 257 people have been hospitalized. Right now in Maine, 157 people are in the hospital with COVID-19. 48 of them are in the intensive care unit, and 109 are in non-intensive care unit beds. Of those 157 people, 24 are on a ventilator right now. Turning for a moment to outbreaks. There is one new outbreak that I wanted to note, and also another that I'd like to provide an update on. The new outbreak is at Bolster Heights Healthcare, a residential care facility in Auburn, where we are aware of 3 cases of COVID-19, all 3 of which are among staff members. I'd also like to provide an update on an outbreak associated with the Oxford Street shelter. Right now, the total number of cases associated with that outbreak stands at 21, 5 of which are among staff members, 16 of which are among clients of the Oxford Street shelter. With both Bolster Heights as well as with the Oxford Street shelter, we're working with the facility operators to focus right now on universal testing, and as specific to the Oxford Street shelter, to help them with quarantine and safe isolation of their clients who may have been tested positive. Turning next to testing metrics. Let's start with PCR testing. Our 7-day PCR test positivity rate now stands at 3.05%, a significant reduction from where we were just 1 incubation period ago. Some part of that reduction in the positivity rate is a function of the testing volume, which remains robust at 722 PCR tests for every 100,000 people in Maine. Just to zoom out one click, just looking at PCR tests, the total number of PCR tests reported to Maine CDC now stands at over 1.4 million. 1,404,000 to be almost exact. That is more than 1 PCR test for every single Maine person right now that has been reported to Maine CDC since we started our work on the pandemic. Turning next to antigen testing metrics. Right now, our antigen testing positivity rate on a 7-day basis now stands at 4.93. Indeed, this is the first time it's come down below 5% in quite some time. The volume of antigen testing has remained relatively steady. Right now, it stands at 159 antigen tests per every 100,000 people in Maine. And let's turn now to vaccines and vaccinations. Overall, across the state, there have now been 158,071 total shots in arms for all COVID-19 vaccines. Of those, 117,613 were first doses, and 40,458 were final or second doses. As a result of that, just over 3% of people in Maine have now received both of their doses of COVID-19 vaccine, and 14 days after that second dose was administered, they will be considered to have been fully vaccinated. Finally, a couple of updates on how today's inclement weather, yesterday's and today's, has and is continuing to affect vaccines and vaccinations. Let's first talk about vaccine delivery. We heard this morning from the logistics experts that are working on vaccine delivery that all shipments for vaccine that were due to arrive in Maine this week are out for delivery. Indeed, we also asked our colleagues at Operation Warp Speed and the US CDC what might happen in case one of those shipments is not able to be received on time or not able to be placed into a refrigerator on time. And the good news that we received is that the vaccine can subsist in the shipping containers that they are placed in for 72 hours without encountering any temperature concerns. So even if those boxes are not fully delivered today, and indeed maybe that goes into tomorrow when the weather clears up a bit, the vaccines will not have been compromised because they can subsist in that packaged environment for at least 72 hours. We do know that as a result of the inclement weather, that some vaccine and vaccination clinics were postponed, We are working with those sites to make sure that they can resume vaccines and vaccinations as quickly as possible with the supply that they are hopefully going to be receiving today and through tomorrow as well. So that is where we stand. I'd like to turn things over to our colleagues in the media at this time. And the first question for the afternoon goes to Megan from WMTW.
For taking my question. I have received some word from some of our viewers that are confused about the different standards and the different rules for different healthcare organizations. So, Maine Health might have a certain set of rules about who's getting the vaccine and when, and, Northern Light has a different set of rules. And I think what's happening is it's creating some confusion about, among certain people, like why can, 70 plus get it here, but over here we're focusing on 75 plus. Is there any plan to really streamline this situation so that I think it would maybe lessen confusion?
Sure, Megan. I think what's going on here is that while we know that everyone wants to be vaccinated, and that's a great thing, and that the categories that we've set forth recognize that there are wide swaths of Maine people who are vulnerable and who will eventually receive vaccinations, we've got to start somewhere. And what Governor Mills has decided to do is prioritize those Maine people who are at the highest risk for death or severe disease associated with COVID-19. The unified place to find information about who can be vaccinated is on Governor Mills' own COVID-19 vaccine or vaccination website. The best way to get to that is to Google Maine COVID-19 vaccination. And on that website, you'll see that for phase 1A, where we focused on healthcare providers and first responders, as well as for 1B, where we're focusing right now on individuals 70 and above, you'll also see that there are others who may be later on in phase 1B. And I think what's happening is that folks are looking on different websites and seeing that although they may be listed, they are then intuiting from that it is their time to be vaccinated. And so, Megan, this is just a distinction between being part of a group versus recognizing that even within these large groups, we've got to start somewhere. So for example, for phase 1B, those 70 and over, that's a phase that comprises 193,000 people just in our state alone. Some systems are recognizing that even within that very large group, there may be benefits in starting with the older folks among that group and then working their way down. Other systems are offering vaccine to all those. Some of it depends on where they are, and some of it depends on how much supply they have on hand. None of this is to suggest that there is any conflict between any of these. It's much more a recognition of the fact that we need to start somewhere, and given Governor Mills' preference to start with and vaccinate those who are at the highest risk of death and disease first, that's where some systems may be starting.
I just have one more question, if I may. Is there any plan to, let me see here. Okay, so when we're talking about genome sequencing, is there any plan for Maine to work with the US CDC in doing that to kind of recognize whether or not those additional strains have been located or how we locate them?
Sure. We've been doing that for quite some time now. I talked about this on a briefing about 2 weeks ago. We at the Maine CDC have been working with two partners to conduct whole genome sequencing of the samples of a subset of the positive results that we get, not just from the Maine CDC lab, but we're working to do so with labs across the state. Some of those samples are sent to our colleagues at the Jackson Laboratories, who have been working in partnership with us to conduct that sequencing. Some of those are sent to the US CDC, where their laboratories can also do that sequencing. We at the Maine CDC laboratory are separately but simultaneously working to bring on that capacity within our own lab for emergent situations where we might need to get a sense of whether the genome it matches one of the ones from the new variants or not. This is not new. This has been something that's been going on for quite some time. Well, long before there was talk about new variants coming from different parts of the world and being detected in the United States, we were already sequencing samples to be on the lookout for any of these new variants, even before they were being discussed in the national media, and we will continue to do so. Let me turn it over to Brian Sullivan next.
Thanks, Dr. Shah. Last week, you talked about Maine going at themselves with developing some systems for people to get registered for the vaccine. I think you said maybe 2 to 4 weeks away. How are we doing? Where in the preparation, the building of those systems?
Well, we are making progress. Brian, let me start by recapping what is currently what was offered to us and why we found it to be insufficient. The initial plan that was discussed back in August and September was for the US CDC to create a unified tool that all 50 states, territories, and jurisdictions could use to schedule individuals for vaccines. That tool was in fact developed. It is called VAMS, and there are a small handful of states, I believe 8 or 10, that initially opted to use it. Most of those, and I've heard from my counterparts in many of those states, have found it to be severely lacking in a number of different fronts and are now actively looking to abandon that and do what Maine has been working on doing all along, which is come up with a tool that actually meets our needs. Unfortunately, the revelation that VAMS was not what it was supposed to be has meant that, again, about 40 plus states are having to fill in the gaps on their own. So Brian, to the extent we are going it alone, we are going it alone with about 40 other states that are looking for solutions that will meet our needs. The needs in Maine are unique as compared to the needs of, say, Washington, DC. Our population is older. Internet access here is not what it is in a small, densely populated urban area. So we've got to design a solution, for example, that concomitantly offers a call center. So folks can call in if using or registering on their laptop or on their smartphone is unavailable to them. We've also got to have a solution that's accessible and easily available to older Mainers. We are making progress. I'd say we are still largely on the timeline that I discussed last week. I want everyone to know that across Maine CDC, this is probably the top priority of our entire team. I've indicated that this is, as I've said before, this is an all gas, no brakes situation or solution that we need to have ready to go. I think we are still on that timeline, but unfortunately, we were left in the lurch when we realized that VAMS was not going to be what it needed to be. So we've had to move and pivot as quickly as we can.
So just to clarify a little bit, are you working with other states in the building of it? It will be a regional system, us and maybe some other New England states, or is it Maine workers doing the work for the state?
It's going to be a Maine-specific solution.
And the other question I had is, I don't know that we've talked about it, at least I haven't heard it on the briefings I've been a part of. The vSafe system, we had a viewer explain that to us a little bit. And can you just talk to us about what that is and why it would be advantageous for people to take part in it?
Sure thing, Brian. So vSafe is a platform that the US CDC developed. It is not a Maine CDC specific platform, although I do recommend folks use it. After you receive your first or second dose, vSafe is an electronic text messaging, smartphone-based or laptop-based check-in system. You register for vSafe the day that you get your first dose. And vSafe will ping you either by email or by text about every 24 hours and prompt you to just click on that link and input any symptoms that you may be having. Pain at the injection site, a headache, a fever, any of those things. It allows you to do a couple things. The first is that it allows you to be mindful and purposeful about your own health, to make sure that you're checking in with yourself to see how you're doing. The second thing is that if you report serious or significant reactions or symptoms, the US CDC has the availability to see that and may even potentially give folks a call, provided they consent to that. The third thing it allows us to do as a country is keep tabs on the number of side effects that may be happening after folks get vaccinated, so we can get a glimpse at how folks are doing after the vaccine. So for everyone out there that is getting vaccinated, I recommend right after you've been vaccinated to Google VSafe, or the site at which you got vaccinated should hopefully be giving you a card or some information on how to access VSafe. It's very straightforward and very seamless.
Thank you.
Thanks, Brian. Let me turn it over to Amy Brown next.
Thank you, Dr. Shah. Do you know what percentage of the deaths with COVID that have been reported in Maine are those who are among people who were never confirmed by testing? And can you say what specifically you're looking for on death certificates in order to include them?
Amy, it's a very small percentage, although it appears as significant blips because we query our vital records database only from time to time. Of all of the 600 plus deaths now that have been reported across the state, again, as of today, sadly, 618. The number of individuals who have been reported or detected from our review of vital records is a fraction. I can get you the exact number, but I would imagine it's maybe 5% at most, maybe 7%. And we look for specific ICD-9 codes that the US CDC has recognized would signify or denote a death with COVID-19. Those include things like COVID-19 being the cause of death or something of that nature. So this is a recommendation that comes from the US CDC as well.
Great. A listener asks why the people 70 and older who have medical conditions that predispose them to a worse outcome aren't being prioritized over healthier folks in that age range. That's not a question that's asked on any of the forms. And since it looks like this rollout for that group will continue for at least a few more weeks, is there any way that people could be prioritized in that way?
Well, I think what we found as a state and as a country, Amy, is that although we recognize that those who are 70 and older and have various medical conditions may be at higher risk, and indeed some providers may be reaching out to those folks first. The other thing we have to do is to make sure we don't create too many layers of priority within priorities. That is what can slow things down at the same time. If we only focus, for example, on those 70 and older with 3 or more chronic serious medical conditions, what about those with only 2? And what happens when we have extra spots on the calendar? What we found is that when you are conducting mass vaccination, you want clear, bright line rules that allow people to access vaccination without having there to be too many questions about whether they are eligible today, next week, next month. Again, some providers may be looking at their rosters of patients and saying, within this group of 70 and older, we're going to prioritize those with severe lung disease, for example. But overall, the approach to get as many people vaccinated as quickly as possible relies on clear, easy to apply, bright line rules. In this situation, 70 and over.
Great. And just real quickly, do you have any updates on the outbreak at the church in Morrill?
We can check. I haven't heard of any outbreaks or updates recently. I believe that as of right now, I'll check and see what the latest case number is, but I haven't heard any significant updates there.
Great. Thank you.
Mm-hmm. Let me turn now to our next question, which goes to Patrick Whittle from the AP.
Thank you very much, and happy snow day. Kind of looking for a little bit more detail on the nature of the Oxford Street outbreak. Is that in the midst of an investigation right now, or are there any details available about how the outbreak started and sort of when it started and how long this has been something that the state has been wrestling with?
Sure. Patrick, we don't have a sense of what the sentinel or index case may have been, Given that there are both residents and staff who are affected right now, we've been trying to piece together the timeline to get a sense of where it may have emanated from. Because of how much COVID there is out there right now, it's possible that there were multiple points of entry. I will get you the exact date of when we opened the outbreak. I believe I first reported on it about a week ago. So I suspect it was around a week or a week and a half ago, but we'll get you the exact date. The focus initially for the last couple of days and into late last week was twofold. The first was conducting universal testing and making sure that we were offering testing to anybody associated with or who had spent time in the shelter itself. Those results and that testing, I believe one round was done on Friday, and then we're working on setting up another round of testing sometime midweek, maybe in the next couple of days or so. The other element that's particularly critical in a congregate living type situation, like a shelter for people experiencing homelessness, is to be able to provide safe spaces for both quarantine for folks who have been exposed and isolation for folks who have had confirmed COVID-19 disease. That's been a significant challenge because of the size of the shelter, as well as the number of folks who are affected. I was briefed this morning that we have found safe spaces for everyone who is potentially exposed or who has tested positive.
Great, good to know. So you found safe spaces for everyone who has been exposed or tested positive?
That's correct.
Is that correct?
Mm-hmm.
Okay. Also, it seems like the weather has been sort of disruptive in terms of some of the clinics. Do you have a rundown available of which ones are open? Because it seems like that's probably shorter than saying which ones are closed.
I don't have that at my fingertips, Patrick. I know that some of the clinics, some of the larger sites did postpone appointments today, but I don't have a sense of which ones did not do so. To your exact question, that would be the easier way to go about this. I don't have that at my fingertips, though. We can look into that and see if we have it at the ready.
Okay, terrific. Yeah, it probably would be helpful because we've been reporting a lot about which ones are closed, which is sort of like a school closure list. It's, sort of basically everyone, but we know that I believe there's one in Bangor that's open, and there might be others, and it would be good to provide that information to the public if it's possible.
Yep, we will see what we can do there, Patrick.
All right, thank you very much.
We're hoping, of course, that as soon as the roads are safe and cleared out, that the vaccine and vaccination clinics spin back up and get back online. Given that doses are being delivered, there would have been folks today who may have to be rescheduled for a day or two from now, but doses should be arriving. There are definitely folks who are waiting to get vaccinated. Even though the numbers from today, because of the cancellations, will be lower, perhaps they can be bookended later in the week, and all the shots that we've gotten into the state can be administered before the next rounds show up next week.
And the Scarborough Downs Clinic is, I believe, set for opening tomorrow. Is that right?
That is correct. That is correct.
Good to know that. All right, thank you for that.
Yep. Thanks, Patrick. Let me turn it over to Patty White next.
Thanks, Dr. Shah. The US CDC has published a report on the percentage of residents and staff at skilled nursing facilities who've received at least a first dose of the vaccine. And in Maine, there's a high uptake among residents, but among staff, it's only between 40 and 59%. Do you have a more granular sense of what the percentage is here and why it's so low?
Well, those data are continuing to come in, Patty. And one of the things I would just note is until all the data are in from those offerings, from those clinics that have been arranged as part of the long-term care partnership, they are all preliminary and they are subject to change, hopefully change upward. One of the things that we've heard from long-term care facilities is that many staff may have opted to pass the first time the vaccine was offered, but having seen friends, family members, community members, people on TV getting vaccinated, when the clinic was offered the second time, a lot more folks stepped up and said, "Yep, I want that." So we're starting to see in the second clinics the uptake rate among staff being very much higher than previously. So that's a good sign. I don't have a granular sense, though, of what accounts for the differences in Maine relative to other states. The only thing I would caution, though, Patty, is it's challenging to draw conclusions until all of the offerings are done. I will say that I've worked closely with the leadership of the long-term care societies and groups here in Maine to get the word out that for folks who are offered the vaccine, the best thing they could do is to take it. And I've recorded messages, had webinars, made personal pleas to workers at long-term care facilities. It's really important. We know that nationwide, as well as in Maine, a really high percentage of the deaths that we've seen, sadly, have been associated with long-term care facilities. By getting vaccinated, employees can keep not just themselves safe, but they can help keep the elder folks in Maine that they care for safe as well. One of the best things they can do for their patients is for themselves to be vaccinated. We've made that plea. We're going to continue doing that, and hopefully we can get those rates up as high as we can.
Okay, thanks. And then it seems like one of the things that we've learned with this vaccine rollout at long-term care facilities is that having local independent pharmacies involved is a good thing and can help speed up the pace of vaccinations. And I'm wondering how that might apply to independent doctors' offices. Some of them are looking to be a bigger part of the vaccine rollout strategy. Do you envision incorporating them more, and how soon do you think that might happen?
So, I hear where you're coming from, Patty, but there are significant differences. One of the reasons that independent pharmacies have been able to jump into the fray and assist with commercial pharmacies is because they have staff that were ready to go, that were not otherwise committed to pharmacy operations in the way that Walgreens and CVS may have been. And indeed, we are actually, because of the performance that we've seen with smaller, or not smaller, but independent Maine-based pharmacies, in some cases they are very, very large. It is as a result of the success that they've demonstrated, we're actually going to be moving more doses to them to help them get out back into the community and give second and third clinics to long-term care facilities, assisted living facilities. So we're looking to move doses away from some of the commercial pharmacies and toward independent pharmacies over the next coming days. I don't know that there is a direct analogy between the work that independent pharmacies have done and independent medical practices. Indeed, independent pharmacies in Maine structurally are very large. They have a high number of pharmacists associated with them. Independent medical practices may be smaller, so on and so forth. So I hear where you're coming from, but I don't think the analogy is as direct. That is not to suggest that independent medical practices can't and won't play a role. This week, although they are not exactly the same thing, we've started allocating doses of COVID-19 vaccine to federally qualified health centers, which occupy a similar niche in their communities. Until we have significant supply, however, we have a choice to make. And the choice is whether how much we put a focus on throughput. Throughput is right now the name of the game. The higher throughput that we can achieve with our doses that are coming in, the more people that we can vaccinate week on week on week. Our goal for the most part is not to have doses left over. Now, independent medical practices can play a role there, but if we get an extra 500 doses into the state, again, we've got a choice to make. And right now our focus has been to give those doses to places we know without a shadow of a doubt can achieve that high throughput. When we have a much higher supply of vaccine, we look forward to being able to furnish independent medical practices. But right now, we don't know when that might be.
Okay. And then just a quick follow-up. You said that you're going to move some doses from the national chains again this week. Can you just tell us how many doses and from which pharmacies?
We don't have a sense yet of exactly how many doses. Some of that depends on how much capacity the independent pharmacies have to pick up those doses and get them into arms. So we're working on that. I had a meeting this morning with our immunizations team, to get the metrics down so we know what we've got available, what the capacity is on the independent pharmacy side, and then we can make the determinations of which facilities are due for their second and third clinics and connect all those dots. That plan will probably take another day or so to work out. And then once we've got all of that ironed out, then we'll make those transfers.
Okay, thanks.
Let me turn now to Kevin Miller at the Press Herald.
Great. Thanks, Dr. Shah. So I saw there was an announcement from the White House earlier this afternoon that they're going to be increasing the number of doses being shipped to Maine, talking about 10.5 million additional doses. Sounds like they were talking about a 5% increase. And then also that they were going to be launching this nationwide pharmacy partnership where people could go to their local pharmacy and potentially get vaccinated. Do you have any details about how that is going to play out in Maine? Do we know how many additional doses we might get and what pharmacies here in Maine could be participated in that federal program?
Sure thing, Kevin. I have some answers on both. Just one really important note. Well, there will be an increase. You noted that it would be 10.5 million coming to Maine. It's 10.5 million for the entire country.
Yeah.
Just so
that would be great. Right?
That'd be great. But I just wanted to make sure for anyone listening, it's as much as we would be ready for that. So Kevin, we are waiting for finalization of what our allotment will be. From what we understand, the volume of doses of Pfizer vaccine will be the same next week as it has been for the past couple of weeks. The increase in that couple of percentage points, that 5% or so, will be accounted for by an increase in the Moderna vaccine. We have received a preliminary view of what that will be, but until it's finalized in the IT program Tiberius, it's just preliminary. We know that it will be the same amount of Pfizer, but a slight increase on the Moderna side. Once we know what that is, we'll be happy to share it. And that's welcome. We thank and commend the administration for continuing to push to increase the allotment to states, as well as to give us some degree of visibility and stability for how it might look, not just for the subsequent 6 days, but for the subsequent 3 weeks. So this is good news, and it will mean that we can make sure that all of 1A as well as 1B are starting to get vaccinated. As to the commercial pharmacy partnership that you noted, there are right now still more questions than answers. We were first briefed on this potential program around about a week and a half ago, maybe. We're still working through the details, namely how much vaccine is coming to Maine, which pharmacy sites, so on and so forth. So we don't have any announcements around that at the time. I have a call later this evening to get further details, specifically around the volume that will be coming into states. Hopefully in the next 2 days or so, probably on Thursday, we'll be able to discuss it in a lot more detail.
And just on that, do you know whether the shipments that would go to pharmacies, would those come out of the state's allocation, or would those be separated on top of what we are expecting to get?
The latter. Based on what I've been briefed, this will be a separate and distinct allotment that will go directly to designated chain pharmacies in different states and will not count against or come from the allotment that we get that we're sending out to EMS, hospitals, places like that. What that precise number is indexed to Maine, that's the question on the table.
All right, great. And then one other question. Given our readership, we get a lot of questions from residents of York County who have been frustrated at what they say is a lack of places where they can potentially sign up for registration, register, and then get appointments for vaccines. And obviously, there's a lot more demand than supply. But as we talked about last week, I think York Hospital did not receive any shipments last week of doses, but they did this week. And York County does seem to has a lower percentage than Cumberland and even Aroostook County of the population that's been vaccinated. So given that, York County has consistently been a hotspot for COVID. Can you talk about why there aren't more vaccination sites or why there aren't more doses that are being sent that way?
Sure. So let's first start with the doses. I'm not going to send doses to places where they can't be administered. I've got to make sure that there is capacity on the ground to administer those doses. Otherwise, sending a bunch of doses to somewhere doesn't help anybody with anything. So that's got to be question and consideration number one. Secondly, we are, as you noted this week, trying to attempt to balance or allocate vaccine slightly more on a population basis. It's not an exact science. It's impossible to make it purely on a population basis. But as you saw, there is significantly more vaccine going to York County this week than there was in the prior week. We hope to be able to keep that trend up as well. Given that it accounts for 16% of Maine's population, we want to make sure we're allocating on a week-on-week basis something that's largely consistent with their fraction of the population of the state. The third is that one of the large, high-throughput, public-facing community vaccination sites that we're working on would be squarely in York County, in Sanford. That's a site that we're anticipating to do high, 8, 9, 1,000, maybe even 1,200 doses per day, shots in arms per day. That will be a significant leap forward for the folks in York County as well. That process is still underway. So we fully recognize that there needs to be both more vaccine as well as more opportunities for vaccination within York County. Hopefully in the coming days, coming weeks, we'll be able to get that in better shape. Finally, the addition or the opening of the Scarborough site will also be a venue for many people in York County to be vaccinated. In addition to York Hospital, in addition to Southern Maine Healthcare, the Scarborough Down site will be a third location that's in that area. So I know that there's not as many sites as folks would have wanted. We're hoping to remedy that with the Sanford site whenever that is online. But there are other locations, again, at York Hospital, Southern Maine Healthcare, and soon at Scarborough Downs.
Great. Thank you so much.
Next. Caitlin?
Oh, sorry. I could not hear you, Dr. Shah. Thank you for taking my questions. So my first question is that virus cases have been declining for 2 weeks now. Do you see that as a reason for optimism, and what could put us at risk for resurgence?
Gosh. Caitlin, I am at my core an optimist. I always try to look on the bright side of life. And so it's hard in this situation because so much of me wants to say things are getting better. And indeed, numerically, there's no doubt that they are. The number of daily cases up until today had been quite low. That's a good thing. The positivity rate had come down significantly. That's a great thing. And the hospitalization rate had come down even more, almost 20%, 25% compared to just 2 weeks ago. That's a spectacular thing. All of those are great. I just don't know how permanent or durable they will be, or let me frame it even more starkly. I am concerned that these findings will not be permanent or durable, that they are in fact a pause rather than a stop. There are a number of things that could change that. Number one would be the most obvious and concerning, which would be the finding of any of the new variants that have been described, whether that folks have undoubtedly heard about. We, as you heard from the discussion earlier with Megan, are on the lookout for those. It is epidemiologically likely that we will find them eventually in Maine. That's one thing that could undo this moment of repose that we've seen. Another would be if folks let their guard down. That's a concern. Folks see good numbers, and there could be the perception that the worst is behind us. And unfortunately, that's just not the case. And so letting one's guard down could be a way that there could be more infections. And the third is events like today or just the cold weather, which drive more people indoors, which could be another venue where there is transmission. So, Caitlin, the eternal optimist in me wants to see this as good news, and it undoubtedly is. The question is how durable it will be.
Thank you. And then my second question is, do you approve of the way that Maine General and Augusta included philanthropy staff and donors in making its test group for its vaccination trials?
Caitlin, I've read the reporting. I think I would refer you to the governor's statement around this, which is to say our priorities in Maine very squarely include equity. You've heard me talk about my twin priorities of velocity, but equity as well. And I think what was reported and it raises questions around equity. The administration has communicated those concerns to Maine General, underscored the need to make equity a focus of everything. I would refer you to the governor's statements around this as well.
Do you mean in the sense, just so that I am clear on it, that like that practice may not have been seen as equitable?
I think that's right. Or I would focus on the word that you used, which is that it may not have been seen as equitable. I have not had independent conversations. I received an email about this after the story was published, but I have not had independent conversations with anyone at Maine General. So I don't have a primary knowledge of the facts at hand, but the concerns around perception of inequity, that's a concern. Let me say it differently. There are so many different ways in which trust is essential to the process going forward. Trust in the vaccine, trust in the information that I'm giving everyone, but an equal piece of this is trust in the process. And these perceptions of trust or favoritism, they raise concerns. Again, I know the governor's office and the governor herself has issued a statement about this. I would refer you to her words.
Thank you. And one more just quick follow-up. One of the reasons that the hospital has given us for why they took this approach is because the state had communicated to hospitals that there was going to be this statewide registration system, and then that fell through on the government side, and that the state was looking to make its own, and that they needed to they felt the need to make their own registration system quickly. I was wondering what you think of that reasoning, and if you could talk a little bit more specifically about what the state is looking for as it tries to build its own registration system.
Sure. As to the former question, what's noted is correct. We were all hoping there would be a uniform platform across the state, across all the states, that would streamline the registration process. It's disappointing that what was developed by Deloitte did not really meet that need. It does mean right now that many hospitals have had to stand up their own registration systems. I don't think, however, other hospitals have encountered the challenges that were reported. So I'll leave that there. What I will say in terms of what we are looking for from a pre-registration / registration platform is a few things. Number one, it's axiomatic to say this, but given the experience with the federal system, I feel it bears note. It's got to work. I'll just start there. It actually has to be able to register the people that we want to be registered. VAMS was not really able to do that in a systematic way. Appointments were canceled mysteriously, so on and so forth. And there's been some recent reporting just in the last 24 hours documenting the myriad failures of VAMS. Secondly, it's got to be really easy to use. It cannot overcomplicate this. It really needs to be the equivalent of Open Table, but for vaccines. Indeed, it's got to be even easier than that. You need to be able to go put your zip code in and then go figure out where you can go, click on a button, get registered, go through the consent process, and then get a confirmation. The third thing we're looking for is that it's got to be easily accessible to all different types of Mainers, those with disabilities, those for whom using the internet is not an easy thing to do, those who may not have broadband access, those for whom English is not their standard or primary language. So it's got to be accessible to a wide array of folks. And then it's also got to be something that's scalable. So right now, or initially, we may only deploy it to some of the sites that the state of Maine is focused on standing up. But eventually, we'd like to make it available to other consortia that may be coming together to offer vaccines in their areas. So it's got to be something that we can scale really easily. All of those things are things that the federal solution was not able to do.
So like, would it be something where people would be connected to the hospitals where they'd be able to be vaccinated, or would this kind of supersede any hospital vaccination process?
That is under discussion. Last week, I actually had a conversation with some hospital leaders to determine the wisdom of whether they could port their registration systems over to this statewide one. That's a challenge because the hospitals have, they've stood up their own systems. So it's possible that what the state is setting up would be applicable only as to the larger sites that the state will be involved in running, and the hospitals, be it Northern Light, Central Maine, Maine Health, folks who are affiliated with those systems will continue to use their registration systems. That's something that we're still working out right now. Certainly, it would be great to have, again, one unified platform, but there are transaction costs of getting a hospital to leave its existing platform and migrate to another one. That's a challenge. That's something we're discussing, but I don't have a final answer on that right now.
Thank you, Dr. Shah.
Let me turn it over to Evan Popp next.
Hey, Dr. Shah, thank you. I realize that this question may be kind of tough to give an exact answer to, but kind of based off a reader email that we received, I'm wondering if you can kind of give an idea of how long someone who's over 70 who's tried to call for a vaccine appointment might have to wait for that appointment. This reader was talking about registering for the vaccine but not receiving a call back yet, and they were hearing from friends of similar ages in other states who have been vaccinated, and we're kind of wondering if Maine is running behind some of those other states when it comes to vaccinating people over 70.
Well, the numbers don't bear that out, first of all. If you take a look at any of the numerous vaccine trackers that have been stood up now, Maine has, since day one, ranked among the top performing states in terms of getting shots into arms, in terms of utilizing our supply, and in terms of getting second doses delivered on time. So although I know there is absolutely frustration out there, it's also important to note that for the frustrated folks, there are folks who are also getting vaccines. Indeed, that is one reason that there is frustration. Folks are seeing their friends who may be part of a different hospital system get vaccinated while they may not be. And that's one reason there are internal concerns within the states of how things are rolling out. Writ large, although we may all be moving in a good direction, still means that some folks are having more difficulty than others. That remains a concern. Now, Evan, in terms of what that might mean for an individual person who is struggling to get an appointment, first of all, I just want to acknowledge, I hear those concerns. I get a lot of the emails that folks send. I see it on social media. There's no question that folks are struggling to get appointments. I hear that concern. I understand where it's coming from. We're trying to build systems to allow that to happen. But one of the constraints in getting an appointment is the supply of vaccine. Indeed, that is the principal constraint in getting an appointment on the books. I know from having spoken with healthcare leaders across the state, they have a high degree of reticence in giving somebody an appointment a couple weeks out when they don't know that there will be vaccine to meet that appointment. Indeed, you've probably seen in other states where the supply has not met the demand, a large number of sites have had to cancel appointments in large swaths, hundreds and hundreds of people being canceled because there wasn't vaccine available. We're trying to avoid that by scheduling folks when we know that there will be vaccine available. It's also important to note, Evan, that although we are, again, delighted that the Biden administration is working so hard to increase the volume of vaccine coming into states, it's going to take time. We're getting approximately 20,000 doses coming into the state of Maine every week, first doses. A large portion of that is going to vaccinate, say, law enforcement and other first responders in phase 1A. A large portion is also going to those 70 and over. But even if we assume, for example, that all of it we're going to those 70 and older, we're still only getting a fraction of the 190 plus thousand people in Maine who are just in that 70 and over category. We're only getting a fraction of it every single week. So it will continue to take time. Let's hope the vaccine supply increases and that the steadiness of the supply that we've seen to date continues. But even at that, it will continue to take some time.
Thank you.
Let me turn next to Ann Burlian from the Ellsworth American.
Thank you, Dr. Shah. I have a couple questions related to the vaccine. And one is, as part of Maine's vaccination process, is there any plan for residents, especially those in rural areas who don't drive or have access to transportation, for them to get vaccinated?
There is, Ann. We are working with area agencies on aging to focus on particularly those elder Mainers who may be homebound, who don't drive, or for whom getting a ride with somebody, or let alone public transportation, those things aren't available to them. So we are working on that, recognizing that concern that many have voiced to us. So that's the plan that's in the works right now.
Is there any clear idea of when that might be implemented?
It will most definitely take some time. We are focused right now on high throughput, large scale vaccination to get as many Maine people vaccinated. One of the best things we can do today to keep those elder Maine people safe is for everyone else around them to be vaccinated. That alone will greatly, significantly reduce their likelihood of encountering COVID-19. If we can blanket the communities in which they live with vaccine so that those who are mobile, who can be vaccinated, are vaccinated, that will be one of the quickest epidemiological routes to keeping those homebound seniors safe.
Thank you, Dr. Shah. And then my second question is about the rare negative reactions to the vaccine. And you said there's an app that people can go on and input whatever reactions they're having, from mild to less mild. But is that information publicly available, or will it be for Maine residents, the negative reactions to vaccines?
So that information goes directly to the US CDC. The Maine CDC is not involved in compiling, receiving, or analyzing those data. All that being said, the US CDC does regularly publish those data. I believe they published one set of it last week. So yes, those data are available from the US CDC.
Thank you so much.
You bet, Ann. And the last question for the afternoon goes to Cindy Williams from News Center.
Hi, Dr. Shah. Thank you so much for taking my question. In looking at the state profile from the Feds dated January 31st, a couple of things really stood out to us. Among them, that 29% of hospitals in Maine are reporting a supply shortage of PPE. And that's actually worse than the national average, which is 21%. Also, that there's a rise of 33% in the number of staff shortages just from the previous week. But we'll focus on PPE. Clearly, the need is great, not only with the hospitals and nursing home staff needing it, but also these mass vaccination sites. Are you concerned at all that we're not going to have enough PPE? Excuse me.
Well, so first thing, Cindy, the kits that come with vaccine shipments contain the ancillary supplies needed to administer the vaccines, be that masks, be that face shields, so on and so forth. Though that PPE is already included as part of the ancillary kits. So no, I'm not worried about that in connection with large-scale vaccination. Now, with respect to the PPE concern that you noted expressed by hospitals, I'm aware of the report that you mentioned. I will say none of the hospitals in Maine has expressed that to us. Indeed, to the extent that they have PPE needs, we have been and are consistently filling those based on the requests that they send to us for PPE, whether it's an N95, surgical gowns, so on and so forth. So I too, to the extent that those hospitals have PPE needs, their first step should be able to reach out to their county EMA with a resource request, which goes directly to the Maine CDC. I'm not aware in any circumstance where we have denied those requests for PPE or have been systematically underfilling those. If we get a request from a large hospital, any hospital, for 195 masks, we fill that request. So I too am, we've reached out to hospitals to ask them, are you experiencing a shortage? And based on the responses that I've received, the answers have been no. So I'm not sure where that number comes from.
Interesting. Same thing for the staff. Shortages up 33% from last week.
I can't comment specifically on the staff piece. I would have to consult with members on my team to understand more what the staffing dynamics are. I don't have any primary information for you on that one, although I can certainly ask folks on my team. But we have a full team of folks who focus almost entirely on PPE, looking at what the supplies are, the needs are, the orders that are coming in, processing those and sending them out to hospitals, as well as healthcare providers across the state. Again, we have a team of several people that does nothing other than PPE. And again, we have not received concerns or systematic requests that we have denied.
I have one other question, if you might allow it. It's actually from Captain Don Kerrigan, so you can't hold it against me. He asks, the people operating Maine's drinking water systems and wastewater treatment systems are asking that their workers get a higher priority for vaccinations because they say those systems are essential to public health and safety, and that people being sick or quarantined compromises the ability of these small staffs to keep everything operating as it should. Could their priority be increased?
Well, right now, I think it's important to note, Cindy, that we are still only getting about 20,000 doses of vaccine coming into the state every single week. That's got to be the starting point. Even though, earlier we talked about in the briefing that there's an increase that may be coming of a couple of percentage points in translated vaccination terms or vaccine terms, that may only be a couple of hundred, maybe 1,000 new doses. Set against, just for those 70 and older, over 190,000 people that we have to vaccinate. Make no mistake, the work that water system employees and municipal sewage and water treatment plant operators undertake is critical. We literally would not have fresh drinking water without it. I think the policy question is how we balance that criticality against the need to keep older Mainers safe. Governor Mills has decided to focus the prioritization for vaccination on providing vaccine to those who, without the vaccine, would be at the highest risk for death or extreme disease. That's been the governor's priority since we started rolling out vaccines. That's why we focused on those 70 and older. If the vaccine supply were to increase, then we can think about where else and to whom else to deploy the vaccine to. But at this time, the governor is focused on those who are at the highest risk of death or disease. And right now, that's an age distinction rather than a job function one.
Okay, Dr. Shah, thank you so much.
Thanks, Cindy. Well, I appreciate all of the questions this afternoon. I'd like to take a second just to recap where we are. Although there have been some positive trends with respect to the data in Maine, lower positivity rates, lower hospitalizations, and lower overall number of new cases every day, there are still concerns on the horizon around the new variants and the possibility that what we are seeing right now is just the ending phases of a potential holiday surge. All of those things suggest that the steps that we've been taking since day one are things we need to keep up. Now is not the time for us to let our guards down. We simultaneously are working to get as many vaccines into as many arms as in Maine as we can. Right now, we're in a race to see whether we can out-vaccinate the virus. If we can keep our vaccine rates in Maine as high as they have been, we've got a shot at outrunning the virus. But if these new variants come into the picture, that becomes a possibility and something that could delay our progress. I've been proud to date of the way that healthcare providers in Maine have come together to get as many shots into arms as possible. We will continue to keep that up. We will do everything we can to try to outrun the virus at every turn. We need everyone's help, though. You can do your part right now, today, by continuing to wear a mask, by continuing to engage in physical distancing, and by continuing to avoid crowds. The better position we start in, the easier it will be to achieve widespread vaccination efforts. The less disease we have today, the less disease we'll have tomorrow, especially when we layer the vaccine on top of that. So with that, I thank everyone for your time this afternoon. As always, please be kind, take care of one another, and definitely be safe if you have to go outside. Let me end by thanking a couple of people today. The first is for our translator, Dr. Thibodeau. Dr. Thibodeau, I have lost count of the number of times that you have joined us, but it is well over 100 at this point. Thank you for your flexibility today, given the weather conditions and the changes. Thanks to Dr. Thibodeau and her entire team for continuing to provide interpretation services. Thanks to Maine Public for continuing to make this spot available, again, given the weather. And a special shout out to all the folks out there who are keeping Maine's roadways safe today. It is an incredible challenge. The Department of Transportation joins our daily briefings every day, and I know that the work that they've been doing is as vital today as it ever has been. So a special thanks to every single man and woman out there who is out there today keeping Maine's roadways safe. Our state wouldn't be able to do what we are today without that, including getting vaccines delivered. So thank you all for your time today. Very, very much appreciate it. We'll talk again on Thursday.